MoleMate is a handheld device which is just placed on the skin. It operates by using different wavelengths of light, and the different wavelengths of light interact with different cells in different ways. And because we know how they interact with these cells, we can identify what's within the skin without having to do a biopsy, i.e. cut a part of the skin out.
Within MoleMate there's a training package which allows the recognition of features visually, which then in turn will improve the accuracy in the diagnosis. We've shown it's easy to learn, it takes very little time to train people up to a standard, and that hopefully means that they will continue to spot features that they've been trained to spot and raise their diagnostic skills. Will make a huge difference. If we can remove melanomas when they've only just been detected, for the patient it means usually a local anaesthetic procedure and a scar, whereas the more advanced melanomas we have to do quite a lot more to take a wider swipe at it to try and remove a margin of healthy tissue to try and reduce the risk of local recurrence of the melanoma. And the longer it's been left, the worse the risks and the worse the outcome, and patients may go on to have recurrence of their disease that might need further treatment. We know that the incidence of melanoma is increasing at about 10% per annum, so it's doubling every 10 years. So actually picking this up is really, really important.
I have an example of a patient who presented with a pigmented lesion on his leg. The lesion only increased in size. There was no evidence of increased pigmentation or that the lesion had bled. The patient was concerned. I was able to take an accurate picture of the lesion, and the index of suspicion came out at 8. I appropriately referred this patient to a dermatologist, who subsequently carried out a punch biopsy and confirmed that the lesion was a malignant melanoma. In terms of contacting the GP, if they know that there is such a device available to screen and detect a lesion at an early stage, rather than waiting and perhaps ignoring a lesion which may eventually become malignant. I certainly believe that a GP will be able to learn to use MoleMate within 2 hours, and I strongly believe that every general practice in the UK should have the use of MoleMate for the early detection of malignant melanoma. So using MoleMate even at this early stage will definitely save lives.